And children under 5 are the only age group not yet eligible for COVID-19 shots, but that may soon change. So here with us, our Chief Health Editor, Dr. Nandi, to help walk us through this. So where do vaccines stand now for our youngest?
Yeah, it's kind of a complicated story, but I've been keeping a close eye on both the Pfizer and Moderna's clinical vaccine trials concerning young kids. And Brian, you know, that's because my whole family is vaccinated except for my youngest son. He's one of the 18 million kids that are not eligible yet for a COVID-19 vaccine. And Moderna expects to release data soon regarding its clinical trials for kids 2 to 5 years of age. If all looks good, Brian, they'll seek emergency use authorization from the FDA straight away. The company went with 2 shots. Each dose is a quarter of the strength that adults receive. And Moderna's dosage amount is higher than that of Pfizer. And Pfizer went with that for their children clinical trials. And each shot of the Pfizer's vaccine is 1/10 of what adolescents are currently getting. And Pfizer had to move forward with a 3-dose series. And that's primarily because of Omicron. Early data showed that Pfizer's vaccine was not producing a good immune response. It was not providing adequate protection against symptomatic infection from the Omicron variant. So now we're waiting on data from the 3rd dose, which is expected in April. If all goes well and 3 shots do the trick, I'm hopeful Pfizer could have a vaccine sometime in May for kids like mine under 5.
I'm sure that there's a lot of parents that are sitting there going, they're looking at the numbers and going, okay, all these numbers are coming down. So is it really even important at this point to get kids under 5 vaccinated?
And it's a super important question. Parents ask me that all the time. And I know parents are confused, especially, since Florida Surgeon General has said that healthy kids do not need to be immunized. However, the American Academy of Pediatrics has said that it recommends that recommendation was irresponsible and that children can die from COVID. We have to understand that just because we think it's not as serious, kids still die. So far, at least 400 under the age of 4 have. And while that may not seem like a lot, those families of those kids are crushed. I would not want to be one of them. And one study actually found 15 kids out of every 100,000 under the age of 5 needed to be hospitalized when cases of Omicron were peaking. And that just because our case numbers are now low, that does not mean we won't see another surge again. I wish I could say with 100% certainty, Brian, that the risk is low. But this virus is super unpredictable. We could very well see another surge due to Omicron's BA.2 subvariant. So to me, the best protection, again, is to get vaccinated against COVID-19. That includes vaccine for our youngest children. My kids have been vaccinated. They've done fine. And I think that that's how you safeguard them. And when we get a vaccine for my 2-year-old, I will also get vaccinated.
All right. Dr. Nandi, grateful for your time as always. Good to see you, sir.
My pleasure.
And if you all have a question for the doctor, you can email him, Dr. Nandi, at askdrnandi.com, or send it to us on Facebook or Twitter. Glenda.